Hello everyone, welcome to my channel Malik Helps. This channel is for all the students who are preparing for KROK 2 right now, and here is the quick breakdown of the things which I find helpful for myself as a photogenic memories, because some of the things are hard to understand as a theoretical part. So this video is to make the KROK 2 preparation easier for you for some of the difficult topics. So hope you will enjoy the video. Let's start with the first thing. So let's start with the first thing. The first thing is brucellosis. The main content to remember about brucellosis is it is caused by domestic animals. So in the KROK question it says like the symptoms of brucellosis are in some milker. So the milker got brucellosis. The main thing to remember is it is caused by domestic animals, goat, sheep, kettles, dogs. Next is Wilms tumor. Wilms tumor is also known as nephroblastoma. It is the most common malignant kidney tumor in children, which occurs in the age group under 5-year-old. So there is a question in the KROK which will say positive ballotment sign. So we want to mark the Wilms tumor as an answer. Another thing is Krukenberg tumor is also there in the KROK question. So just so you know, the Krukenberg tumor is a metastatic ovary tumor which will arise from the stomach and malignize to the ovaries. Next is molar pregnancy. As you can see in the normal pregnancy, the embryo is a single celled embryo or with the normal size inside the uterus. But in the molar pregnancy, you can see a lot of fluid filled cysts, or let's say tumors. So it's the tumor of the trophoblast, the molar pregnancy. So the KROK question will say vesicles for sure, some sort of vesicles when it will say. So the keyword for molar pregnancy is vesicles in the KROK question. So we have to mark molar pregnancy. So these are the signs of appendicitis. A lot of signs are there. So this is a picture showing cardioversion. Let me tell you when to mark the urgent electrical cardioversion or when to replace the pacemaker. So when the KROK question says straightforward that the diastolic BP is like 40 or below, so when you see in the KROK question there are serious condition of the patient, so mark the answer urgent electrical cardioversion. And when the KROK question is asking you that which will be the best treatment, or when the question states the long term treatment, then the best thing is to replace the arteria, or let's say replace the pacemaker. So next is myiocitis. The main thing to remember in myiocitis is Gauthron lesion. We may sometimes misdiagnose myositis with psoriasis because the Gauthron lesions are also some sort of silvery scale type thing. But the question will say Gauthron lesions, so we don't have to mark psoriasis, we have to mark myositis in that question. Another symptoms you can see lung cancer, photosensitive rash, heliotropic rash which is around the eyes of the person, and muscle inflammation. So mark myositis for that. Next is Lissage test. So Lissage test is also called as a straight leg test, so which is used to assess the sciatic compromisation due to the lumbosacral nerve root irritation. The examiner will slowly raise the patient leg, extend the knee until the patient reports the pain. So Lissage test is positive when the patient reports the pain on the elevation of the leg. Next is corneal abrasion. This is a photo showing healthy eye, and corneal abrasion looks like this on the eye. So next is Cushing's triad, or increased intracranial pressure signs. So we all know the signs of shock is decreased BP, increased pulse, and increased respiration. So the symptoms of increased intracranial pressure are just opposite to the signs of shock, as we can see, which will be increased systolic blood pressure, decreased pulse, and decreased respiration. Next is the picture showing micturating cystourethrogram, so in which a contrast dye is filled into the bladder for the better results. So we will come to know how the urine is flowing through. If there is any injury, we will come to know through the contrast, as the contrast will start to leak out. Next is a photo showing dilation and curettage, in which the dilation tool speculum is inserted into the vaginal opening for dilating the vaginal opening, and the curettage is used to take a biopsy of the uterus or the inner line of the uterus. Sometimes when we suspect the endometrial cancer, we take the biopsy from the uterus lane. Next is skin prick test. In skin prick test, what the doctor does is the doctor use all the things like which are possible allergens and inject into the patient's skin. So as a result, when we will see edematous results, we'll come to know that which of the allergen the patient is allergic to, and which are the things which should be eliminated from the patient. The patient shouldn't contact those things. This is skin prick. Next is trichomonas, which is also known as trichomonas colpitis. In this picture you can see the KROK question will say the discharge is profuse, the discharge is foul smelling, the discharge is foamy, the discharge is the patient complains burning and itching in the genitals. So this is the photo showing the symptoms of trichomonas colpitis, like frothy colored vaginal discharge, irritation, itching of vagina, surrounding area, or most of the men don't have symptoms or only mild ones, discharges and pain in urination. So these are the symptoms of trichomonas, but for I have told you the main symptoms which the KROK question will say, like the profuse foul smelling discharge, foamy discharge. So we need to mark the trichomonas. Next is amylotropic lateral sclerosis. So in lateral sclerosis, it is progressive neurodegenerative disease which will affect the motor neurons, only the motor neurons, like the upper motor neurons and the lower motor neurons. So the KROK question will say that there is no sensory or coordination problem. Because it's the motor problem, so there will be no sensory disorder. The symptoms we will see: muscle weakness, muscle cramps, twitching, stiff muscles, speech challenges, trouble swallowing, drooling, fatigue, involuntary emotional expressions, and Babinski sign we will see will be positive in amylotropic lateral sclerosis. So the KROK question also says that muscle strength decreased by 2 points. Muscle strength also decreases in multiple sclerosis. But the main thing which we use as a hallmark to mark the answer for the question is no sensory or coordination disorder. Next is multiple sclerosis. So multiple sclerosis is something autoimmune disease which will affect the CNS now. So now we will have problems with the sensory system. So this is also a neurodegenerative disorder. The signs we will see there, we can see a lot of symptoms in this one, but I want to highlight the main hallmark finding for the KROK question. So the main thing is since the symptoms are sensory this time, so the question will say unsteady walking. The patient cannot walk properly because there is problem with the sensory system. And if we want to see something hallmark point of for the multiple sclerosis, that is optic finding. The optic finding, as we can see, the KROK question says temporal pallor of the optic disc, or let's say optic neuritis. This is the hallmark for multiple sclerosis. Another hallmark which we need to see in the multiple sclerosis is ataxia. Ataxia is simply lack of coordination and impaired balance. So this is the thing when we have to mark multiple sclerosis. As you can see, the problem with the vision. This is the photo showing the symptom. Vision, spinal cord, senses, muscle, brain, mouth and speech, digestive system, urinary system. all the system get affected because it directly damages the CNS and have problem with the sensory system. In amyotrophic lateral sclerosis, we see the problem with the motor system, only the problem with the motor system. So there will be no sensory problem in the lateral sclerosis, and the problem in multiple sclerosis will be sensory. Next is kidney stones, which is also known as nephrolithiasis. So as we can see, there are a lot of type of kidney stones, but there is a direct question over the Stag-Holm calculus. So this is, as of I know, is the biggest stone ever. The question is simple. Questions asked about the treatment. The question directly says that some elderly patient have Stag-Holm calculus. So what's the treatment? As we all know that we need to remove it surgically. Venous insufficiency. So first of all, we're gonna see the spider veins. After the spider veins, we are going to see the reticular varicose vein. Then there is varicose vein trunk and the chronic venous insufficiency, and finally there will be tropical ulcer. Next is the photos showing a lot of types of obesity. So there is android obesity, which is more common in the male. So it is also known as apple-shaped obesity, in which the fat deposit will be in abdomen, chest or upper back. In the gynoid obesity, it is more common for the women. It is pear-shaped, and the fat deposition we can see in the hips, thighs and buttocks. Also dysplastic, it's the question for the dysplastic obesity will be like a Cushing profile. The question will say that the fat deposit is on face, neck and trunk. So this is also known as Cushing type obesity. So the main thing is about the Cushing disease. When to mark the Cushing disease? When the question says that ACTH levels are increased, then you have to mark the Cushing disease. And if the question says like there are disproportionately thin limbs of the patient, then don't forget to mark the answer as dysplastic. So next, Horner syndrome. Horner syndrome is a problem with the sympathetic nerve supply of one side of the face, which will result in the myiocitis, which is constricted pupils, ptosis, drooping eyelid. The eye will not be able to open properly, and anhidrosis, which is failure to sweat. This is a photo showing the insertion of the nasogastric tube. There can be a lot of purposes. So we insert the tube through the nasal passages, through the esophagus and to the stomach, and we inflate the balloon so that it doesn't move. It is easy, everyone know about it. Back striate we have done, which is distended jugular veins, the muffled heart sounds and decrease in arterial pressure. This is the photo showing the extracorporeal membrane oxygen. I saw it somewhere in the KROK question that they are using it somewhere. So here it is. Next is analgesics, also known as painkillers, which relieves the pain. They are used for the headache, muscle pain, neuropathic, trauma and fractures. So there are a lot of other medications that can be used as analgesics, which is antidepressants, anticonvulsants, corticosteroids or local anesthetics like lidocaine. Next is a picture showing Quincke's edema. In the KROK question about the Quincke's edema or angioedema, the question states like a 6-year-old girl drank some fizzy drink and she have a feeling of pressure in the throats. Her lips got swollen. The edema gradually start to spread over the other body parts, and she have laryngeal breathing. The breathing become difficult, and breathing rate is 28, pulse is 120, something like that. So basically they were asking about the basic aid which should be provided for the patient. So that's corticosteroid. Remember to mark corticosteroids as a treatment of angioedema in the KROK question. Lisa's test we have done already. So this is a photo showing fibroids. In some of the KROK question I have seen that a question was there which was saying that there is a history of uterine fibroids, so I have to mark the uterine fibroids as an answer. This is a picture showing twisted pedicle or fibroid. This is a picture showing the adrenal glands, like which hormone is released by which portion of the adrenal gland, like the medulla part or the cortex part. So you can remember, if you want, you can remember all of them for the knowledge purposes. But if you just want to solve the KROK questions, so you just need to know that medulla part secretes the epinephrine and norepinephrine, and the cortex part releases the cortisol, aldosterone and androgens. Next is pleural empyema. So pleural empyema is simply the pus gets to filled in the pleural cavity. It is result from the infections most of the time. So how to diagnose this condition? This condition is diagnosed by imaging, like ultrasound, CT scans with contrast, chest x-ray. Chest x-ray is most probably enough to diagnose this. And sign and symptoms we will see in the patient is fever, cough, chest pain due to the fluid buildup over the area. The treatment is simply drainage of the pleural cavity, and prescribe antibiotics for prevention of the reoccurrence. The causes, as we can see, is pneumonia itself could cause is any trauma or surgery in the previous history for surgery. After surgery it can occur, or some sort of bacteria can cause this. Here you can see the photo showing empyema. We can see the pus filled in the pleural cavity. So basically is a result of infection. Next is anthrax. So a lot of things we can remember about the anthrax, but the main thing to remember is this black lesions. The KROK question will directly say the area after this and this got black. So we remember about to mark the anthrax, and the choice of treatment for anthrax is penicillin antibiotics for KROK question. Symptoms, as you can see, lung, skin, GI or such symptoms. Mark penicillin antibiotics for anthrax, and when you see the black skin lesions, mark the diagnosis anthrax. Next is Erb's palsy and Klumpy's palsy. So Erb's palsy is the problem with the C5 and C6, whereas Klumpy's paralysis is the problem with C8 and T1. So in Erb's palsy, it's the upper trunk injury. We can see the waiter's tip posture, the internally rotated arm, the abducted arm, and extended and pronated forearm, flexed wrist. So it is the position of the waiter's tip, problem with the C5 and C6. In the Klumpy's palsy, it is the lower trunk injuries, C8, T1. In the KROK question, it will directly say the claw hand deformity. So we have to mark the Klumpy's paralysis. So this is a photo showing acute kidney injuries. The causes, what can be the causes for the pre-renal, renal or post-renal injuries? So one by one, the pre-renal injuries can be caused by the cardiac failure. If the heart get failed, it will not be able to supply to the renal artery, and this is simply what we know as an acute kidney injury. Sepsis can cause this, blood loss, dehydration or some sort of occlusion can cause this. The renal causes are glomerulonephritis, drugs, toxins, and infections can do the renal injuries. Post-renal problems are basically cancers, prostate enlargement, or any kind of fibrosis, or bladder cancer, prostate cancer, cervical cancer. All these can be all these can cause post-renal injuries. This is it with this video. I hope you find the video helpful. So if there is any doubt, or if you want to ask me, feel free to comment me in the comment box, and share the video with your friends who are preparing for the KROK 2. Thank you so much. Have a good weekend.